Hi, my name is Marcella. I'm a Nightingale nursing student. I will be showing you my IV insertion and discontinuation video. Um, I've got my name badge, my Nightingale nursing scrub attire on, and I will be going into the patient's room after I get all the orders and sanitize my hands and inserting an IV to this patient. Looks like they're getting an IV hydration. I'll verify the patient's name and date of birth, verify the allergies, and explain what I'm doing to the patient. Okay, I'm gonna go knock on the door. Knock, knock, knock. Hello, Mrs. Willis. How are you doing today? Good, good. Can you please verify your name and date of birth? Great. My name is Marcella, and I'm gonna be your nurse today. Looks like there's an order to place an IV in your arm today, so we can give you some hydration. Are you okay with that? Great. And then can I just check your name back? Can you please give me your first and last name and your date of birth, please? Destiny Willis, 9497. Let me verify I've got the right patient chart here information. Yes, okay. And Destiny, do you have any allergies? No allergies? Okay, great. All right. So then I'm going to gather my supplies, which that I have here. I will sanitize my hands, give patient privacy. Gonna put an IV in you, and I'm gonna go over the steps while I do it. Okay. So I've got my 20 gauge needle for the IV insertion, my IV kit, which includes a tourniquet, some gauze, and some alcohol swabs and some tape. I've got some more alcohol swabs over here. I've got my IV extension kit here, my normal saline flush, and my tourniquet. Okay. So, okay, Miss Willis, the first thing that I'm going to do here is I'm going to tie the tourniquet. I'm going to wash my hands, tie the tourniquet around the arm. First, I'm going to put some gloves on, actually. I'm sorry. Some gloves on. I'm going to tie the tourniquet around the arm here. I'm going to tie it about 4 to 6 inches above the insertion site. Going to make sure we got a snug fit, a little bit nice and tight, enough to where you can release it once it's placed and ready to be released. Okay, good. All right, and then I'm going to search for a good vein here. Okay, I'm going to check for a distal pulse. Perfect. Distal pulse present. Okay, and then once I find the correct vein, the site where I'm going to insert, I'm going to grab my alcohol swab. I'm going to clean the site where I will be injecting the needle in this area, and I'm going to clean within the circular motion here. Okay. Make sure I dry the area. All right, while that's drying, I will get my normal saline and my IV tubing here, and I will get this started here. And first thing I'll do is I will make sure that there is no bubbles, everything's draining properly. Great. Okay, I'm going to grab my syringe here. It's going to be a 20 gauge syringe. And I have my IV kit here. All right, perfect. Okay, then once the area is dried there, I'm going to take the lid off of the needle, make sure that the bevel is standing facing me up. Okay, I'm going to anchor down the insertion area, and I'm going to anchor down below about 30 to 40 degree angle. I'm going to push in about 1/4 of an inch, and then I'm going to flatten it out once I get the vein and I see a flashback of the vein coming through the syringe there. So I'm going to push straight the catheter all the way into the catheter here, IV insertion catheter. Okay, and then I'll make sure that's stable. I will click this part off and put into my sharp container here that I have. Okay, IV insertion is in place. Okay, then I will grab my IV tubing and make sure this is stable. I will IV tubing up to the needle here, the IV. Okay, and then I'm going to take this tourniquet off. Going to flush in some water and pull back. Make sure that there is some blood flowing and there is no redness, swelling, or any problems with any infiltration here. Okay, perfect. All right. And then what I'll do is I will remove the normal saline syringe once I see that everything's intact and try to keep everything stable here. So I will twist this off here and take the normal saline syringe off. Clamp the tubing before I do that. Okay, all right, move this here. Okay, so IV insertion is in place here. Then to stabilize the IV, I will grab my Tegaderm here, which is going to cover the IV area, leaving enough space for the open port to stay open, okay, to be able to access IV. So I'm going to open the Tegaderm here. Oops. Okay. There we go. Okay, it's got a little up bevel arrow down. Then I'll place it right at the edge of the bevel of the needle, enough to leave the port open at the bottom, not covering the port area. I'm going to just make sure that stabilizes down the tape nice and securely here, as smooth as I can get it. And then I'm going to pull the backing off here. I'm going to pull the other piece off of here. Okay, great. So IV is stable, in place, holding well with the Tegaderm. Okay, and then I will take this tubing here and I will just wrap it around here like this so it stays in place. And I will grab a piece of tape just over here. Grab a clear piece of tape. I'm going to tape it down and stabilize it properly so that it stays in place until it's going to be used. Make sure that's taped down. Okay. And then I will also take a label and I will mark on the label the date, the time, and the number gauge is 20 gauge to let them know when it was placed and what time it is. So we'll staple that and put that on there. So today is 4/14/26 and it is about 7:57 p.m. and then my initials is MG. Okay, perfect. All right. So now we have the IV insertion is in place. I'm going to remove all of my supplies and explain to the patient that we are finished here and that I'll follow back with her when I'm done. All right. So I'll remove all of my supplies. Get everything out of the way here. Clear the area. Get rid of my syringe. Get rid of my tape. Get rid of all my garbage. Okay, Mrs. Willis. So we're going to go ahead and I'm going to sanitize my hands. I'm going to document everything that I did here today. I'm going to go communicate with you, provided that the IV was inserted successfully. Are you having any pain before I step away? No? Great. I'll go ahead and monitor the site again for any redness, swelling, or infiltration. No redness, swelling, or infiltration. Everything looks good there with the label there. Okay, and then I wash my hands again, walk out, and communicate with the doctor that the IV insertion was successful. Okay, so I'll walk out. All right, and then I will be now doing the IV discontinuation. And I will let the nurse, it has been over a day or so, and the patient has had the IV hydration done. So I will go in and get the IV discontinued, and I'll let the patient know what I'm doing as well. And make sure that I have the discontinuation order in place, and that I verify the patient. I'll wash my hands. Knock, knock. Hello, Mrs. Willis. How are you? Good, good. Can you please give me your name and date of birth? Okay, Destiny Willis, 9497. Great. Let me check your name badge. Okay, Mrs. Willis, it looks like we are going to be discontinuing your IV now. The doctor says that your hydration order is over. So it'll be nice and quick here. I'm going to sanitize my hand, check the discontinuation orders, and remove the IV from your arm. Are you okay with that? Great, perfect. Okay, so I sanitize my hands. I'm going to put some gloves on. Get these gloves on properly here. Okay, get the other glove on here. All right, let's see here. Okay, great. So for the IV discontinuation, I will need a gauze, some tape, my sharps container, throw my sharps away. Okay, all right. So to discontinue the IV, I am going to take off the tape here that I had put on there. Gotta remove the tape carefully so I don't pull the IV out and hurt the patient. I don't want to cause the patient any pain or anything like that. So let's go ahead and get this going here. Okay. All right. Second here. Get all my stuff out of my way here. I'm sorry, everything's a mess here. Okay. All right. So we're going to go ahead and we're going to remove the tape while stabilizing the IV site and the needle. Get rid of this tape. Going to remove the tape here. Carefully, okay? While stabilizing the IV site down, still have my hand on the IV. Okay, remove the tape here as best I can. Okay, all right. And then I am going to hold the arm down, and I'm going to pull back at an angle, straight back, and then up at an angle as slowly as I can go. And I'm going to have a gauze with me at the same time before the whole needle gets pulled out, and I will put pressure down where the insertion site is. I will hold for a few seconds to let the blood clotting. In the meantime, I'm going to take a look at my needle to make sure everything is intact, nothing is missing, nothing looks concerning. Get rid of this in my sharps container. Okay. All right. Tape is sticking everywhere. Okay. All right. So got about 10, 20, 30 seconds. Depending on the patient, whether they're taking blood there or not, may take longer to clot. Okay. And then I will take another piece of gauze. And I will just cover the area here. And I will grab a piece of tape. Make sure that the gauze is in place with a little bit of pressure to make sure it's not continues to bleeding. Okay, Mrs. Willis, we're gonna go ahead and leave this gauze and bandage on just for a little while to make sure that you don't have any bleeding. Are you doing okay? You feel any pain? No? Okay, great. Okay, I'm gonna go ahead and let the doctor know that we went ahead and removed the IV insertion and that you're doing well and you're feeling better. I'm just gonna gather my supplies. I will wash my hands, document everything that I did, and report to the doctor. And thank you so much, Mrs. Willis, for letting me care for you today. I hope that you continue to do well. And that's the end of my video. I'll remove my gloves. Get rid of all my supplies. Sanitize. And walk out the room.